A humanitarian crisis is gripping California. Every day we see the headlines, read the stories, or witness it firsthand. Far too many people living with mental illness and addiction find themselves cycling through our hospitals, jails, and city streets. It's become a perfect storm. Our behavioral health workforce is overwhelmed, our hospitals are overcrowded, and our criminal justice system is dealing with a challenge it isn't built for. It's time for action.
I'm Steinberg, founder of the Steinberg Institute and co-author of California's Mental Health Services Act. I'm often asked, why does it feel like things are getting worse for so many people, despite our spending billions of dollars on programs and services? The truth is, all of the new resources and innovations put forward by California have helped many people, and yet our systems do not always work in a coordinated way, and people too often cannot get the help they need in a timely manner.
I'm Karen Larson, Steinberg Institute CEO. We're announcing an innovative initiative to address this crisis and get people the help they need. We're calling it Vision 2030. Vision 2030 will bring new research and data to the table to reduce the cycle of hospitalization, homelessness, and incarceration for those living with behavioral health conditions. The state of California has been investing billions into lots of programs, many providing life-saving care, but we don't have good data to assess what's working and what isn't. Our plan is going to change that.
Vision 2030 is our plan to come armed with information, ready to rally resources where they are needed, and ultimately have care systems in this state that rise to the challenge and ensure people get the timely help they need and deserve.
We'll challenge assumptions, ensure transparency, and provide recommendations based on solid data. Top priorities include addressing the workforce crisis, understanding the intersection of mental illness and criminal justice, hospitalization, and homelessness. We are committed to using our research to improve the care and outcomes for our friends and neighbors who are struggling. We know there's more to dig into, and we will be using the latest research, models, and technologies.
Since I founded the Steinberg Institute in 2015, we have taken on key behavioral health policy issues, crisis response, youth mental health, housing for the severely mentally ill, and much more. We are advocates for change and aim to provide cutting-edge public policy research to help policymakers in California and beyond devise all that it will take to fix these broken systems.
It's my belief that there can be no optimally run system without accountability and outcome measures embedded into it. It just doesn't exist otherwise. This means that we have to think about how providers, how systems work in general, how all of those things work together to come out with good outcomes and good measures and good accountability.
California has been embarking on major transformation of our behavioral health system, and for good reason. And if we are serious about that transformation, if we are serious about becoming a behavioral health system for all Californians, an equity-anchored system, a system that is tracking towards important outcomes that matter to Californians, then we've got to measure it. So we hope and expect that the Steinberg Institute's approach, its Vision 2030 approach, bringing together research, data, analysis, and pushing our system forward further, is not just going to benefit those who pay close attention, but all Californians wherever they are.
Challenges must be met with the urgency they deserve. Vision 2030 is our plan to intervene in this crisis and embrace hope and recovery. I hope you'll visit steinberginstitute.org/Vision 2030 for more information. Sign up for updates and support us as we embark on this exciting initiative. With your help, we'll achieve this vision.